Hello friends, welcome to Drishti IAS Editorial Analysis. In this editorial analysis, we do three things. First of all, we link the editorial to the UPSC Civil Services exam syllabus. Secondly, we try to understand the key points mentioned in the editorial. And thirdly, if any key concept has come in the editorial, then we try to discuss that as well. Now let us begin today's editorial analysis. Today's editorial has been taken from the Hindu and it has appeared on 4th of May. It says that a less rigorous lockdown does not mean COVID-19 has been overcome and challenges remain both for the government as well as for the citizens. So it directly links with GS paper 2 and GS paper 3. In GS paper 2 we have these functions and responsibilities of the union and the states. So the central government as well as the state government, they have this responsibility of controlling this pandemic. And also it deals with the subtopic which is issues relating to poverty and hunger, because of the disproportionate impact of the lockdown on the migrant workers. In GS paper 3, we have this topic of economic development, and under this we have Indian economy and issues relating to planning, mobilization of resources, growth, development and employment. So it relates with this as well, because the Indian economy has been brought to a standstill due to the lockdown and now efforts are on to revive it. So that is why it links with this topic as well. So after establishing this linkage with GS paper 2 and GS paper 3, now let us look at the key points. The editorial says that a less rigorous lockdown does not mean COVID-19 has been overcome. And this is very commonsensical, because what we are looking at is a graded exit from the lockdown. There was a choice at one time between saving lives and livelihoods, and the government took the choice of saving lives. But now, as Prime Minister Modi has also stated, that we want Jaan as well as Jahan. So we have to focus on both lives and livelihoods. Plus this realization that we cannot wish the COVID-19 away. We have to learn to manage with COVID-19. So a graded exit is what that is being planned by the government. So lockdown was all about buying time, and this time has been utilized by the governments to improve the testing rates, to get the ventilators in hospitals and to improve the hospital infrastructure, healthcare infrastructure in the country, and also to get the personal protective equipments for the healthcare professionals. And also this period of lockdown has been utilized by the government to create awareness among the citizens about face masks, about hand washing, about social distancing, how all these are needed to prevent this COVID-19. And these will be very important for managing COVID-19 now. Editorial further says that the center has extended the national lockdown for COVID-19 for 2 weeks from May 4, but with fewer restrictions. So we are looking at a toned down version of the lockdown. But at the same time, the highly contagious virus has not disappeared, and the weeks ahead present a challenge to the state governments, especially because we realize that the public health or health subject comes under the state list. So the central government can plan for all the states in India, but it is the state governments which have to deal with the situation on the ground. And here we should know that state list or all the lists are mentioned in the 7th schedule of the constitution, which comes under article 246. So this is also important from prelims point of view. We should be knowing this. Now what are the challenges in front of states? So states have to ensure that all the gains from the lockdown in terms of relatively low death toll so far and a cap on new cases are not reversed. So the states have this responsibility to make sure that whatever has been gained in this lockdown period in terms of keeping down the death toll and improving the healthcare infrastructure, improving the facilities, that should not get reversed now that restrictions are being eased off, and the primary responsibility for that lies with the state governments. Now the central government has categorized the districts under 3 colored zones: red, orange and green, and they will have varying degrees of activity allowed in these zones. Now red will have the most number of restrictions and the green will have the least restrictions, and the orange will come in between. We'll see these zones in detail in the key concept section. And there will also be the containment zones, which will have the highest restriction, and these will normally be in the red zones because they will have the positive cases. Here the editorial says that Kerala has chosen to retain some curves even in the green zones. So Kerala, which is a leader among states in terms of social and health indicators, so it has decided to retain some curves even in the green zones, and this is a pointer to other states because India is a very diverse country and the social and health indicators vary across the states. So a state like Kerala, which has very good indicators, it is also realizing that maybe lifting all the restrictions at one go is not prudent. So it has decided to retain some curves even in the green zone, and maybe other states should also take a cue from this. Now the state governments are also suffering on another account, and here we can take an example of the Delhi government, which has said that April month usually their revenue generation is around rupees 3500 crores, but this time due to this lockdown situation they have been able to generate only 300 crores, which is a decline of more than 10 times in revenue generation. So this is putting the states at a very difficult situation, and they are finding it difficult to pay salaries of the state government employees. So that is a difficult situation, and the center must take note of this and should come to the rescue of state governments. Editorial further says that allowing some economic activity under safeguards was inevitable. Although the Home Ministry's orders require a high degree of civic cooperation, that is, cooperation from the citizens is also needed to make it successful. The continued suspension of air, rail, interstate, and urban public transport, and the bar on mass gatherings like weddings, other social gatherings, and entertainment venues removes a major source of crowding and the spread of this COVID 19. The biggest issue with COVID 19 is the easy way in which it spreads from person to person. So, avoiding mass gatherings is the best way of curbing the spread. It further says that the restrictions on the number of passengers allowed in private vehicles and taxi cabs and the protocol for personnel in industries call for strict adherence to succeed. And this is where citizen cooperation is needed, because the government and the police personnel cannot be present at all the spots. So the responsibility falls on the citizens to make sure that they follow the government guidelines and stop the spread of this COVID 19. Also, allowing outpatient clinics to reopen and the permission given for plumbers, electricians, and other technicians to work with safeguards are welcome, because these professionals were also facing a lot of difficulties during this lockdown. And because they were not able to provide their services, other citizens were also suffering on account of that. So, allowing of their services is a welcome move. The relaxation process can be eased greatly if states adopt a how to approach and communicate to citizens clearly. Now, this is very important, that the communication from the government has to be very clear, and it should be phrased in such a manner that it makes it very clear for the citizens to understand it and follow it. Something like do it yourself kind of instruction should be there, that whosoever is reading the government instruction can clearly make out what is allowed, what is not allowed, and if one activity has to be done, then in what manner it should be done. Because we have seen previously that even the Ministry of Home Affairs order regarding the movement of transport vehicles during the first lockdown, they were not properly understood by the state governments, and there were a lot of disruptions, and the Ministry of Home Affairs had to issue clarification. So when it was the case in a government to government communication, and such problems in government to citizen communication are more likely. So the government should take adequate safeguard in making sure that its communication is properly conveyed and understood by the citizens. Further, the editorial says that in the absence of medical remedies, prevention remains the only option against the virus. So we have to learn that instead of fighting the virus, now is the time to managing the virus. We have to manage COVID-19. And for this, using of face masks, which have now been made mandatory, hand washing and physical distancing at all times are universally recognized precautions, and they must be adhered to by all of us. Editorial further says that such measures were adopted relatively late in India, with politicians initially reluctant to even adjourn legislatures, leave alone impose strict curbs on public activity. Here we have examples in the form of the recent wedding in Karnataka of a former chief minister's son, where some of these social distancing and other protocols which are for all the citizens were violated. And this sends a very wrong message to the society. So law should apply uniformly to everybody, and everybody should be made to obey the rules and regulations which have been framed. Next, the editorial makes a very important point that the states have to prepare for the return of migrants. So there are two types of migrants. There are the internal migrants and the migrants from abroad who might return because of this COVID-19 pandemic. Editorial says that it has taken more than a month to move migrant workers back to their home states by train. And in the interim, several desperate families have tried to walk home across vast distances and many have perished. And this was the scene all over the TV channels, which showed how the migrants who were left with no jobs, no money, and no food security, they made this decision to walk back to their home, and many of them also perished. And this shows the government in a very poor light, that the government did not take care of the migrant workers as it should have. We'll see migrant workers in little more detail in the key concept section. Editorial further says that states must ensure decent conditions for these workers and the education of their children. There have been calls by a lot of social activists that this Mahatma Gandhi Nation Rural Employment Guarantee Act, its scope should be widened in the face of this COVID-19 pandemic, and the number of days should be increased from 100. At the same time, right now it allows for only unskilled manual labor. So here it should also allow for some kind of skilled labor as well, which will be very helpful for these migrant workers to find work at home or near their homes. Also, the states must prepare for the arrival of expatriate workers in large numbers, especially from West Asia and also from other countries. Now, why West Asia? Because most of the migrants in West Asia are blue collar workers. So here we should know what is a blue collar worker, what is a white collar worker, and also a red collar worker. There are many other colors as well, but for now we should be knowing blue, white, and red. Red collar means government employees. Desk jobs are what are called white collar jobs. The blue collar jobs are basically manufacturing sector jobs, and these are basically factory level workers, and these are also called as working class people. So in West Asia we have most of the migrant population comprising of these blue collar workers, and now due to this double crisis of COVID-19 plus this oil price decline, due to this many of these migrant workers who are mostly blue collar workers, they are going to lose their jobs and they will come back to India, to their respective states. So the state governments must plan ahead how to absorb them back in the economy, and also how it will test them, quarantine them, and if necessary treat them for COVID-19. So that kind of planning is needed on the part of state governments. Here again, Kerala is a front runner. Kerala is expecting around 2 lakh migrants to come back, and it has started to make plans for their return as well as their reabsorption in the state's economy. Editorial further says that all of these things add to the need to maintain the highest vigil against COVID-19. All these challenges are in addition to meeting the COVID-19 challenge, which makes the problem that much more difficult. Finally, the editorial makes a point that the biggest cities with a legacy of market-driven housing policies, unplanned densification, rampant pollution, and poor healthcare access are all in the red zones with large infection clusters. And we can see that all the major metro cities, Delhi, Mumbai, Kolkata, Chennai, Bengaluru, Hyderabad, all are in red zone. And these cities are providing more than 50% of the GDP of the country. So their continuing in the red zone is not good for the economy as well. But at the same time, we must reflect that why these cities are in the red zone. The editorial also says that the decay is marked by the absence of usable commons, including pavements in normally crowded localities, making it difficult to maintain distancing. Now, for example, we have this Dharavi slum in Mumbai. It has around 8 lakhs people in an area of 2.5 square kilometer. Now, one can understand that how densely the people are living and how social distancing can be maintained in such places. And this is the failure of the government and the governance structures. Editorial says that this would be an appropriate moment to start repairing the damage that we have caused, and the cities have to reflect and to start repairing the damage that they have inflicted on themselves. Finally, the editorial says that what the public must be told emphatically is that the relaxation of the lockdown is not a return to life as it existed before the coronavirus. It is a new reality, one that calls for safe, measured activity. So the public needs to realize that we are not returning back to the normal, but it is a new kind of normal. It's a new normal that we have returned to, and we have to make sure that we manage the COVID-19 pandemic and we allow the economy to gain. its vigor by adhering to all the safety protocols suggested by the government. So these were all the key points in this editorial. Now let us look at the key concepts. In concepts to learn today, we'll look at red, orange and green zones and migrant workers. Let's look at the red, orange and green zones. What are these? Now the government has extended the nationwide lockdown by 2 more weeks starting May 4th. And the Union Health Ministry has issued a revised list of districts under red, orange and green zones. So a total of 130 districts across the country have been placed under the red zone, while 284 and 319 districts respectively have been identified as orange and green zones. Now this revised classification is based on the incidence of cases, that means the number of cases that were found in these districts, the doubling rate of cases, the extent of testing and the surveillance feedback. Now as per the revised criteria, the green zone are districts which have not reported a fresh case in 21 days. So if a district doesn't report any fresh case for 21 days, then it is classified as a green zone. And the orange zones are those with few cases, and they are basically have not been classified as red or green zone. Now the red ones have a large number of cases, positive cases, and in the new classification, metropolitan cities like Mumbai, Delhi, Kolkata, Hyderabad, Pune, Bengaluru, Chennai, Ahmedabad, they have all been designated as red zones. Now the list will be revised on a weekly basis or earlier and communicated to state governments for further follow-up action in consonance with the directions issued by Ministry of Home Affairs under the Disaster Management Act 2005. This act is also important because almost all the major actions being taken by the government are being taken under this act, Disaster Management Act 2005. Even the lockdown has been announced under this act. The other important act is the Epidemic Diseases Act 1897. Now let us look at the migrant workers. According to this International Migrant Stock 2019 report, which is released by United Nations Department of Economic and Social Affairs, UNDESA. This is important and should be knowing this, that International Migrant Stock report is released by United Nations Department of Economic and Social Affairs. So what this report is saying, that India has remained the top source of international migrants, constituting 6.4% of the total world's migrant population. And the most preferred destination for the Indian migrant is UAE, followed by the US and then the Saudi Arab. In India, the highest number of international migrants come from Bangladesh, Pakistan and Nepal. Let us look at this internal migration. So Economics Survey 2017 says that the annual average labor migration was close to 9 million between states during the period 2011 to 2016. And the share of migrants in the workforce lies between 17% and 29%. So this is a huge number. And Delhi, Maharashtra, Tamil Nadu and Gujarat, which are the more prosperous and industrialized states, they attract large number of migrants from the source states of migration, which are basically Uttar Pradesh, Bihar, Madhya Pradesh. Also, Odisha supplies a number of migrants. So this was all in today's editorial. Now let us see what kind of questions can be asked in prelims or mains related to this editorial. In prelims, basically you can be asked about the zones, criteria for classifying them into red, green or orange and things like that. But the more important connect of this editorial is with mains and maybe writing an essay. So there you can be asked about revival of economy or about the issue of migrants, how they are coping with this pandemic situation, what steps need to be taken to help the migrants in the long run. And there are various steps which you should know, like the One Nation, One Ration Card scheme, the JAM Trinity, how it is helping, the Jan Dhan account, the Aadhaar and this mobile connectivity, how this is helping in targeting the benefits to the poorest of the poor. So this is also important. And these migrants, they have been in news so much that this becomes a very important topic that must be prepared both from essay point of view and also from mains answer point of view. So this was all in today's editorial analysis. We'll see you next time with another editorial.